Hello and welcome to Health Assay. I'm your host, Amazing Tife. In a state with a large population density as Lagos State, it is crucial to have a health emergency response that would cater to the needs of its citizens. Today we're going to be having a conversation on the Lagos State health emergency response, analyzing its strengths, its weakness, and how it has fared in recent emergency situations. Joining me as we have this conversation is Dr. Tunde Ajayi. Dr. Babatunde Ajayi is currently appointed a Special Assistant on Health to the Honorable Commissioner of Health. He is an astute and result-driven public health physician with extensive experience and training in primary health care delivery, occupational health and safety, emergency medicine, epidemiology, and research. As a health systems efficiency expert, he led the oxygen strategy for Lagos State during the COVID-19 pandemic, where he managed production, supply, distribution, and end-user availability of oxygen at the isolation centers. A public health fellow of Eremus Mundus, Dr. Babatunde Ajayi obtained his Bachelor of Medicine and Surgery degree from the Lagos State University before proceeding to the Catholic University of Louvain, Belgium, where he obtained a Master's in Public Health and subsequently a Master's in Business Administration at Warwick Business School. Dr. Babatunde Ajayi is an highly analytical and adventurous man known for adding value to the systems and organization with a saleable vision of making a revolutionary global impact. Good morning, Dr. Ajayi. It's nice to finally meet you. So please, can you introduce yourself to the audience?
Good morning. My name is Tunde Ajayi. I'm a medical doctor, a health systems efficiency expert. Currently work with Lagos State government as special assistant on health in Delta.
All right, so let's talk about health emergency response and assessment. So the first question I have for you is, what is your experience with managing health emergency, particularly in a very large and dynamic city like Lagos State?
So health emergencies, first of all, they come in different forms, right? They can be individual, they can be mass casualty. You can have health emergency in the home, in the office, in industries, different workplaces, at nightclubs. So all of those have variations on the kind of response you give.
Okay.
So with managing it in Lagos, the first organization or the first structure that comes to mind is the Lagos Ambulance Service.
Okay.
Now we have a swift response system, I'd say the best in Nigeria, that responds quickly. Quickly means with a response time of under 15-20 minutes, yes, to emergencies that they are called out to do. So with respect to, handling health emergencies in Lagos, I think that we have fared very well, morphed over time, and we have morphed into a structure that is capable of handling mass casualty, like we saw recently. And these things happen from time to time. So from single casualty to multiple 10, 5, 7, to mass casualty over 100 at a time.
Okay.
So with Lagos, we have done that extensively and we have mastered the art over time. We do a lot of drills, so we simulate scenarios that would make us prepared for the actual event, when it happens. And that was exactly what played out recently.
Okay, so you mentioned 15-20 minutes. Is this irrespective of location within Lagos?
Yes, irrespective of location. So if you go around Lagos, you'll see that you have Lagos ambulance points, Lasambos points in different parts of Lagos. So you on the bridge, for instance, on the Third Mainland Bridge, there's a Lasambos vehicle at different strategic locations. So we now have what we call Lasambos bays, right? So we have 15 of them around Lagos, strategically located in different local governments. So depending on the terrain, but on the average day, if you're going to call Lasambos, you will get us in 20 minutes.
That's interesting. Yeah. All right, so the next question, can you describe Lagos State's approach to risk management and preparedness planning for potential health emergency?
All right, so the planning approach really is multi-leveled or multi-layered. The first one is actually the understanding and the structure of the organization that plans that approach. Now there's a communication end of it, so where we receive communication from the public. So there's a 767-112 number that goes on a dashboard, and then those emergencies are picked. Emergencies ranging from trucks falling on people, to people sleeping in their houses and falling and hitting their head, to road traffic accidents, that involve small cars, to fire, to all kinds of things. So there's a dashboard that collates all of these things together, and then it's dispatched into different sections. So, when you get a call, if the Lagos State Emergency Management Agency does that and then sends it to the particular agency responsible. So, and then send it to Las Ambos. Now, for the health the health side of things that we are specifically talking about now, when it comes to Las Ambos, there's a trigger, there's a chain of command. Immediately, someone maps it, someone tells you the ambulance that is closest, they call the ambulance that is closest. Each ambulance is equipped with personnel, driver, medic, or a nurse, or a doctor sometimes, depending on the severity. And then it has proper equipment. So, equipment that can take up to advanced cardiac life support. So you have ambulances that have basic life support and then advanced cardiac life support. So, depending on the extent of the damage or the accident, then we dispatch the appropriate ambulance. It goes on to the destination. Pick up the person, takes them to the nearest hospital. Nearest hospital being priority is general hospitals, because they offer secondary level of care. Right. So most of the time people will call for ambulances for things that can be handled at the secondary level at the very minimum. If you have a random headache in the house, you're not likely to call an ambulance. So take them to the nearest general hospital. You get it sorted. If it's not something the general hospital can handle, then they escalate to the tertiary center, and then the person gets sorted. However, it is worthy of note that the government pays for the first 24 hours of treatment for every patient that is picked with Lagos Ambulance Service. A lot of people do not know this, but it's something that is in the structure so that nobody is denied healthcare because they don't have money to pay for their care in the first 24 hours. And per global standards, the emergency room is supposed to be for a very short period. So the first 4 or 5 hours, everything is sorted. You're moved on to the specific specialty where your problem will be solved. And then when you get to that specialty, if you have an insurance, for instance, it still goes on for free because your insurance, if you have Lagos insurance or any insurance you have, it goes on to solve your problem at that level. And then, if you don't have insurance, then you have to pay for the rest of it. But the first emergency care, first 24 hours is covered by the Ministry of Health.
Interesting. No, many people don't. In fact, I didn't know about the first 24 hours cover, but that's good to know. So, how do you ensure effective communication and collaboration among stakeholders, including government agency, healthcare providers, and even the general public during health emergency?
Okay, so communication is a very critical component of our operations, and I can see clearly that all of the agencies work together. They work hand in hand. We have seen this play out every time we've had an emergency. So the coordinating agency is the LASEMA, Emergency Management Agency. And then depending on the response that is required, they bring fire service, they bring Las Ambos ambulance service. They can even bring LASMA to control traffic to that site, right? They can bring, if they like, Federal Emergency Management Agency or FRSC. All of the agencies involved. So there are clear chains of command, right? And there's an agreement on who controls what, who coordinates that activity. So with that coordination, you're able to zero in on what exactly you want to do, and then we're able to achieve more because there's collaboration. Several examples everywhere. The days when building collapsed in Ikoyi, for instance, all the agencies were on board. They came in swiftly because there was a clear command and control chain, right? And then there's sufficient communication to say you are going here next. This is what you should do. This is what you should do. So there's no confusion. Right? And it works seamlessly.
Okay, so let's talk about the issue of fake news. Okay,
Mhm.
now how do you address issues related to misinformation and fake news during health emergency, particularly in this era of social media?
Well, so I think that fake news is a big problem. However, the Lagos State government has a structure that permeates into every locality. For instance, if you tell me there's fire burning in Mushin, I mean, first of all, there's neighborhood watch in every corner of Lagos,
Yes.
right? So I can just go down to neighborhood watch and say, "Oh, can you help me get your guys in this area?" And then find out if there's actually a fire there. And in that instant, you'll be sure someone is there.
Okay.
Because whatever happens in any locality, no matter if you start a fire in front of this office, I am dead sure that in 2 minutes you see a neighborhood watch officer there. So they are in every local government, they are in every LCDA. As a matter of fact, every small group of streets have them, moving around, and everybody knows them. They are members of the community, so people know them already.
Okay.
So we have our information gathering mechanism, right? And then we quickly dispel fake news. So of course the government has a Ministry of Information that has a social media team, and if the news is fake, they immediately dispel it. So we're not going to swing into action on fake news, right? We usually have to confirm it first before anybody moves the needle.
Okay, all right, let's talk about the recent health emergency case we had. So can you describe the experience and also the process implementing emergency response for the recent bus train accident which happened on the 10th of this month, March?
Yeah, so it was quite an unfortunate event, to be honest. And what we have seen, or what we saw really was, a train ramming into a bus that was in its path. Right, a lot of people were affected. Unfortunately, some lost their lives. About 6 people so far, and total casualty count was 102. The response was swift. The emergency management agency got there in 5 minutes.
Okay, that's good.
Yes, that place is literally 2 minutes from Lassos. So Lassan bus was there immediately. Evacuation began immediately. Moved them to Lassos. Now, the interesting thing about Lassos is that I would say it's the most sophisticated, health institution right now in Nigeria. Right?
Interesting.
Yes, they have equipment you would not find in any other federal or state facility, and they have preparedness like no other. Again, the preparedness is understandable. I mean, we're Lagos, right? And then in Lagos, because you have all of these factors, population, I mean, multimodal transport, you have emergencies coming up all the time. There's no day you wake up and something has not happened.
Okay.
Right? So, so what happened then was Lassos had prepared for days like this. There is no month that Lassos doesn't do drills and simulations for things like this. They simulate different kinds of incidents and accidents. I remember clearly the head of the operations head at Las Ambas was saying, "Oh, this was the exact scenario they simulated a few days ago." Right. So they had trained, they had practiced for days like that. So the moment he came in, I mean, calling medical officers or health workers to come out was not even a problem. It was just a bell. And then he rang in the whole hospital, and then everybody came out. Came to that convergence point. As patients were arriving, all the doctors were on standby. They were ready to get on it, and they did immediately. And the organization was seamless. I'll tell you why. I mean, it had, apart from the external command and control chain, right, there was also the part where within the hospital, there was a communication center where you needed to just go. They just set up quickly, they set up a communications desk 2 minutes from the triage point, right? At that communications desk, you could go there and identify when this person came in or who was involved, right? Immediately. Now, you had someone continuously announcing that if you are looking for your relative, just go to the communications desk so that people don't come in frenzy and then start searching every single person, So there was a communications desk. You won't have that happen if you had no plan for it.
Exactly.
There was a water point. I mean, it doesn't sound like a serious thing, but you have hundreds of people in one place. People will need water. People will need basic things.
Yes.
Right. So we had that. There was a very smooth movement.
Okay.
So when you have triage, you must keep them in an open area so that you can quickly spot what is going wrong, and you can quickly tell if there's a problem with this person, there's a problem with this person, you know. And then whenever people are stable, move them to different wards or move them to hospitals where they can be handled. We had very many severe injuries. I mean, at least about 42
Okay.
severely injured people, and you had to quickly sort them out and then dispatch them to different general hospitals where they can handle them. The ones that had to be done immediately, about 6, 7 people were moved into theater immediately, you know. So by 4 p.m. that day, triage was complete. Everybody had been dispatched. 102 people had been dispatched to different hospitals, and the ones that were in Lassus were a lot. At least 40 of them were in Lassus,
Okay.
having different levels of care.
Okay.
Next day, some had been discharged home. Day 6, today is day 6, I guess. By day 6, I think we have less than 40 people
Interesting.
remaining.
That's
Everybody else had been discharged. 66 had been discharged by yesterday.
wow. That's a very interesting number
Yeah.
of people discharged.
That's the power of Lagos.
Yes.
That's the capacity that Lagos has developed over time. And that's the evidence of a working system, a functional system.
Wow, that's beautiful to note. So, let's talk about this big issue that was trending, the triad, the triad system and all. Okay, so can you just enlighten us about the use of this triad and the role it plays in emergency response? Because it was trending a lot on social media, a lot of people with their takes, and so just let's hear from you.
Okay, so triage basically is a model of handling emergencies where you sort out people. It's basically a sorting process.
Okay.
Right. So if you have a group of people come to you and you need to know who is mild, moderate, or severely injured, you need to have a space where you can sort them out. Okay, this is severe, this is moderate, this is mild. The mild, go to a general hospital where you can have a basic medical officer handle you. The moderate, go to the advanced ones, the big general hospitals where you can have surgeries immediately. The severe ones, we will handle them here. If you are going to do that, because you have mass casualty, 102 people will not be in a ward. Number two, there is no health institution in the world that has 102 bed spaces waiting for an accident to happen. You are never going to find it anywhere in the world. 102 beds, nobody has it. The emergency room in any hospital is always keenly fought for. Like, it is not something that you find lying empty. Lassus clearly won't have 20 free bed spaces for emergencies.
Okay.
Because Lassus is the last bus stop for every hospital in Lagos. They just send straight to Lassus.
Okay.
Right. So it's the referral point, it's the referral center. So what Lassus did was to use their triage center. They had a helipad right in front of the surgical emergency, deliberately so, to make sure that you have an open area that is clear and devoid of any kind of interference or obstruction. Nobody can randomly park inside. You get? So for days you have emergencies like this. It's not a place where you can mistakenly use as a car park, or where you can just have things lying around and hanging. No, it is always clear, ready for emergency. That's why it's called a triage point.
Okay.
Many hospitals across the world don't even have a triage point. They just use middle of the road.
Yes, true.
Yeah, so right there where it happened, they would use the middle of the road and then try to sort it. But then, with the way Lagos is structured, if you saw videos, you see the number of people who were around that accident scene. Trying to sort anybody out there and then was going to be a problem. Yeah, so move them into Lassus. Make sure that they are seen by medical doctors. I mean, there's no better way to triage than in the middle of a place where you have all the doctors that you can possibly have. Right, so you had all the specialists there. Lassus has all specialties, right? So you have all the specialists there. Everybody is immediately seeing and spotting, oh, this one should get immediate surgery. This one should go here. This one should go into the ICU. This one should do this. So the triage point is where you sort people out. It's a sorting place.
Okay.
It's not an admission room, right? So the average person who just sees it says, oh, people are out in the open. No, it's a triage point. It's a sorting area. Lassus is world class, and the things we do are excellent, right? So with that kind of arrangement, it was easy for us to say, oh, this group of people will go here, this will. And then by 4 p.m., we're done with that. Folded up all the canopies, and the place is empty, right? For the next landing, maybe a helicopter landing or another emergency. You're not going to have these emergencies every day. But on
Yes.
the days when you have them, you will be glad that you had that space, right? The reason you prepare is not for today. You prepare for the days when the things will happen. So what we did at that time was to properly arrange and execute that sorting out process. And that is what Triad is all about.
Okay.
There's nowhere it would have been done better anywhere in the world. It is what we have in Lagos. We have to be proud of our own. We have to
Yes.
make do with what we have. We have to promote what we've done and what we have achieved. And I think this is sterling. It's never been this good. This is Lagos. This is
Mm-hmm.
Lassus. We are the center of excellence, and we have done this excellently. We have executed in a way that has set a pace for other health facilities in Nigeria, and we have highlighted the importance of preparedness, for health emergencies.
Okay, that's beautiful to know. In fact, hearing this from you first, and I'm really proud. Okay, so let's go to the next questions now. So, how would you measure the effectiveness of Lagos State health emergency response system?
So I think that we are doing excellent. However, we have one or two improvement points, right? We need to have a wider spread of our ambulances. And I mean wider spread, we need to make it more visible. People need to see and know that we're able to do these things that we
Yes.
do, right? So I know there are several improvement points, but so far we're not doing badly. We have greatly improved over time. We have tested our processes. Um, we have run these things and made it work over and over again. So I think that the emergency services are good, and we will improve again. On different areas. Every time you do something, you see a gap, fill it up, and then keep it moving.
Okay. Okay. All right. So the next question is, in your opinion, what are the strengths and weaknesses of the Lagos State health emergency response system?
Well, I think I just indirectly answered that. So the strength really is that we have been tested many times. There's almost no year that you don't have mass casualty because of the nature of Lagos, the way it is, smallest in size, largest in population. If you have millions of people cramped up in one space, their activities will trigger, health emergencies and general emergencies. So we have improved over time because we have used our systems, we have tested our systems with many challenges, right? So I think our rate was high. Improvement points, yes, we will improve, we will continue to get better, we'll continue to expand. At some point, I know that we will have helicopter ambulances. We actually have one, and we will see the need to use it.
Okay.
We'll be able to use it better over time. But I'm very positive that we're doing very well.
Okay, so what steps do you think Lagos State has taken and will also take to improve its health emergency response system?
Steps. Number one, we're constantly recruiting.
Okay.
Number two, the cadre of staff that you require for health emergencies will be mostly nurses and paramedics. So we're designing our own paramedics curriculum,
Okay.
right? In our own hospitals, our own teaching hospital, so we can train paramedics right now, and then make them work for our own system. So it's not just in the physical, it's not just in the training, the immediate training, on the job training. There's also training for the future. Lagos actually has emergency medical services in key hospitals across Lagos. In fact, we have a hospital dedicated just for accidents and emergencies.
Wow.
A whole big general hospital just for accidents and emergencies on Lagos Ibadan Expressway. It's just by 7 Up, by the toll gate.
Okay.
Right. So every accident that happens on Lagos Ibadan Expressway, all the way to Third Mainland, ends up there.
Okay.
Right. So we have those things in place. Again, we can expand, we can do better, we can, and then we're very futuristic in our approach to things. For instance, the 10-lane road coming from Badagry to Mile 2, that entire stretch is very large. There's a train in between.
Yes.
There will be accidents there when it's done. So we are building a general hospital in Ojo as we speak. We're almost done with the general hospital. As a matter of fact, the general hospital and the road will be completed about the same month.
Wow.
so that when those accidents happen, there's a place to take them to, right? That hospital also has obstetrics facilities, because when you open up a road, you open up access to those places. More people will move there.
Yes.
So you have more women, more children. So Lagos is planning, very futuristic in our approach to things. We have planned for what will happen. We have planned for what is currently happening. And I think that our improvement points are basically going to be around personnel. You know, we have a high attrition rate because it is Lagos, right? So people they leapfrog from Lagos to abroad or anywhere they want to go. So we constantly recruit. And Mr. Governor, in his wisdom, has given us the ability to recruit without needing a second level approval. So whenever anybody leaves, you can immediately replace. Whenever someone leaves, you can immediately replace.
Okay, that's beautiful.
Yeah.
So for the public knowledge, can you just tell us again the emergency number in case of any health emergency to call?
Yeah. So the Lagos emergency number is 767 and 112. So if you dial 767, someone is going to pick. If you dial 112, someone is going to pick. They're going to register your emergency, and then immediately people will swing into action.
All right. Thank you so much, Dr. Ajayi. It's been really, really lovely hearing from you and also getting this information. I'm really proud of the milestones that the Lagos State healthcare system has achieved, and I look forward to more beautiful achievements in the coming years. Thank you very much.
Thank you very much, Pauline.
Now, that was a very insightful conversation with Dr. Babatunde Ajayi, and it is evident that Lagos State is taking very intentional steps in addressing health emergencies across the state, with establishments like LASEMA and their very quick response time. Now, this brings me to the end of today's edition of Health Assay. If you've enjoyed it, remember to give it a thumbs up. Also, remember to like, share, and comment, all right, and subscribe. And until the next time, cheers and stay safe. Bye-bye.